Greetings, I'm Sumantra Ray, and I'm speaking to you on behalf of the Tigris program, Transforming India's Green Revolution by Research and Empowerment for Sustainable Food Supplies. I'm one of the co-investigators and a co-lead for Flagship Project 6 in Tigris, led by the University of Cambridge through its Global Food Security Interdisciplinary Research Centre and funded by the Global Challenges Research Fund of UK Research and Innovation. I'd additionally like to acknowledge the Economic and Social Research Council for priming some work that has fed into the programme that I'm going to be talking to you about today. So Tigris, as you'll already know, has 6 very interdisciplinary flagship projects, and in particular, the flagship project 6 looks at impacting well-being in rural and urban communities. So there are several E's that we consider here: education, empowerment, entrepreneurship, all leading to improved human nutrition. And within this, I'm going to be focusing my presentation on the mobile teaching kitchens, and I'll come back to that later. Just like to highlight that I have been collaborating with Tigris in my role as Executive Director of the NNedPro Global Centre for Nutrition and Health, which is an independent think tank headquartered in Cambridge, looking across the piece at human nutrition and health, as well as all of its connections with food production, food environment, and food choices. So really, on behalf of the NNedPro Global Centre and Tigris Flagship Project 6, I'm going to try and describe the mobile teaching kitchen model and its policy implications, as this is a multifaceted as well as innovative intervention which seeks to address diet and health-related challenges. So what is a mobile teaching kitchen? Well, it's essentially a nutrition education tool to improve diet and health outcomes, particularly in those communities that are marginalized, underserved, and have particularly challenged socioeconomic backgrounds. A mobile teaching kitchen can actually serve as a community hub for nutrition and health screening, as well as preventative health, so doing more than simply what's in the title. It can empower communities with skills and knowledge that actually can give them livelihoods around cooking healthy, nourishing meals, passing this information to others, but also running this as a micro-enterprise. So the aim broadly of such a model is to tackle food insecurity and particularly the risk of malnutrition, targeting local communities, so stylized to local needs, thinking about what is effective and works in terms of nutrition education that is tailored to communities that have specific needs, and really disrupting the vicious cycle of intergenerational poverty, particularly providing greater food and nutrition security. The mobile teaching kitchen model draws from the See One, Do One, Teach One process, where in the first step there's a needs assessment, followed by training of volunteers, and followed by training of champions, and ultimately knowledge dissemination to the community. In this particular model, we've utilized dietitians and doctors who work with local volunteers, social workers, educational champions, in some cases farmers, and those involved in rehabilitation or skills development in communities. And really this mixed bag of local volunteers has enabled health professionals focused on nutrition to actually create MTK champions. And these champions then interface with the community. So some of the key components include food handling and hygiene, cooking skills, understanding the importance of what constitutes a nutritionally complete diet as we go from farm to fork, retaining knowledge and skills, the ability to convey this information, and very importantly, teach others and pass the knowledge on through the see one, do one, teach one approach. So interactions in urban slum communities initially looked somewhat like this, and you can see some researchers who are interacting with volunteers as well as with the potential champions in the slum community. And really at the other end of the process, we have a picture that looks a little bit more like this. And this is a snapshot of knowledge dissemination through Kolkata communities. And this has been lateralized to other parts of India through the Tigris program, where you can see a much more organized setup in terms of meal preparation, and really locally sourced, sustainable, healthy, tasty, very nutritious, yet cost-effective meals based on multiple menu templates, which have been created particularly so that the culinary champions can also act as health educators, and whilst they sell their food, they can also serve up health education and other types of awareness that lead to empowerment. So after the piloting and evaluation of this model in Kolkata, it's being scaled to Punjab and also beyond in India. This model provides education to members of 2 marginalized slum communities in the first instance, but through the amplification model that we've just seen in Sodoto, this can be transmitted to potentially tens of thousands of recipients of knowledge. Do visit this web link if you'd like to watch a short video on this. We're further lateralizing this model beyond the life of the Tigris program through collaboration with a long-standing charity, Calcutta Rescue, and a grant from the Azim Premji Foundation, which is going to enable us to see how the champions from this model can actually problem solve in a number of neighboring urban communities across 6 different slum areas. And in parallel, we will develop a similar initiative in rural Punjab. So the markers of success of this particular model are that just training teams of 3 to 4 champions means that we can actually prepare and sell 100 meals a day. Each one is an opportunity to share knowledge and support towards behavior change and healthier food choices, healthier cooking habits, and better health outcomes. So really, with 1 van and 5 champions, we can impact about 24,000 people per annum. And so this has a multiplicative effect. This is over a 3-year period that we have actually managed to look at curbing the tide of malnutrition in slum-dwelling communities because of simple changes that have been made to the sourcing, selection, and preparation of foods. This also led to the production of a mobile teaching kitchen cookbook showcased in 2 Cambridge University festivals over 2021, and one that has international reach, but draws from the 50 recipes and menu templates which are promulgated through the mobile teaching kitchen by the champions. This is a peer-reviewed paper in BMJ Nutrition, which really brings out key messages around mobile teaching kitchens being used successfully to educate underserved communities, measurement of changes in knowledge, attitudes, and practices, giving us a feasible way to look at impact, and also really all of the insights that tell us that this is a scalable model and one that can impact multiple sections of the population. So although the model has been focused on women in marginalized communities, aspects of the model also look at children. And I'd just like to acknowledge young Nikita, who was really behind the blueprint of drawing the mobile unit, but also bringing in the participation of children who have been working with their mothers as part of a mother-child unit in supporting the mobile teaching kitchen. So going from local to global and thinking about COVID-19, some of the thinking underway is to utilize the 12 regional networks across multiple countries that the NNedPro Global Centre has access to, and there are adaptations already underway in as diverse and far afield places as Mexico and even Scotland. So in Mexico, in August 2021, utilizing the mobile teaching kitchen model in India and the findings from the Tigris investigations, Tech de Monterrey has started a 3-city initiative, which is now supported by the mayoral government of Mexico City. And this has adapted the model for local cultural, linguistic and dietary context. And first phase data collection is already underway. So in the UK, there are a number of transferable lessons that we can bring back, and really community food partnerships, which have been very effective in COVID-19, could provide the ideal milieu within which to bring an adaptation of the MTK, learning from low to middle income settings and impacting pockets of marginalization and deprivation right here in the UK, where we're headquartered. So just some of the insights for policy. So a successful intervention that relies on a disruptive innovation such as the mobile teaching kitchen can promote a healthier food environment. It can enable a multi-sectoral set of stakeholders, health professionals, industry, media, consumers, to understand challenges and the role that we need to play together, delivering healthier food options whilst thinking of food security, and thinking about education needed to improve diet and diet-related indicators and outcomes, keeping this targeted at those who are most affected by poor dietary outcomes, so addressing inequalities and inequity, and thinking about the wider impact that this sort of model can have on the aspirations of a community through improving cognitive flexibility, mentalizing skills, and livelihoods. So just to end, here are some of the brilliant champions who have been running the original prototype of the mobile teaching kitchen in Eastern India, and their lives have been transformed in these past 3 years as they've gone from being some of the most marginalized people in their community to culinary health educators and micro-entrepreneurs, able to impact not only their own communities, but people like you and I, and indeed inspire international collaborations and initiatives, all from one set of humble beginnings with aspirational thinking. And this has been made possible through the innovation that has been laid down by the Tigris program, and particularly its food, nutrition, and health related contingent. So thank you very much, and do visit this web link to learn more about this project. Thank you.